feel safe.
Yeah.
I feel trusted, right? I think that would be fine, right? We have those values, the principles, have that as one of the measures that you can use, Okay. But how do we help that child feel safe, trusted, and trustworthy, supported by peers, collaborative, blah, blah, if that teacher doesn't feel that way, okay? Which means we need to know the wants and the needs of the teacher, right? And that teacher needs to know what behaviors to engage in that are going to impact the student to meet their wants and their needs. Okay, if we want that for the teacher, now we need to go up the chain. We have to chain that performance. Okay, what's the administration need to do to help them feel safe and trusted and peer supported and all those kind of things, right? And it's going to come down to their behavior. And all those things need to be driven by the values. One of the values is trauma-informed care, right? Those principles or whatever. But if you don't break it down to the interlocking behaviors, right, that are aligned with this result that's measurable, you do not have a trauma-informed environment. And this can all be unpacked. And that's what I did here. So I think the problem with it coming off of everybody's tongues too much is that the kids who really need to be treated with kid gloves, for lack of a better term, right, are not getting what they need, because if everybody's traumatized, then nobody's traumatized. Okay. And we got to make sure that they really get what they need, because they've had exceptional, and those environments that we worked in, Mike, those ones where lots of these guys were probably by definition, traumatized, to impact their behavior, we had to impact the behavior of the 40 teachers in those schools, right? We can look at the PBIS. It wasn't about PBIS is about adult behavior, not student behavior.
It is most certainly. And Paul, I really like the point you made about the idea that trauma-informed care is, in order to make the environment predictable, I think, and sort of supportive, rules and sort of guidelines and limits are an essential piece of this. I think if you talk to anyone who treats kids with trauma and they talk to parents, one of the first things they talk about is, yes, you're going to be very compassionate and understanding about what this child has gone through, but your environment is going to be predictable and sure, because rules and things like that equal safety. Kids feel like someone's in charge, because so often they feel out of control. So the way that you help them to learn that is, okay, when I come here, I'm safe. Everybody, the grown-ups are in charge. They're helping. Look around me. There's helpers as far as the eye can see. So I think you're exactly right. And to do that, you can't be someone who's constantly in fear of losing your job or getting screamed at as a teacher, right? By a higher up.
Well, I think they also feel that if somebody's been in trauma informed, that it means that they can no longer correct behavior, and that if they correct behavior and the child throws, responds emotionally, that somehow they're being re-traumatized. And certainly whatever that means, but certainly that if it can be the case with somebody is been truly traumatized, right? They get, I wish that we could, ideally we would have some sort of biometric, that showed that a stimulus in the presence of this stimulus, and it's generalizable, the stimulus in different areas. Well, the stimulus is there, that you get this kind of response, heart rate increases, blood rate increases, whatever it is, that go along with, because maybe there's some people who you're not seeing the overt behavior at all, right? They're just kind of getting wide-eyed, right? And all this other stuff's going on in there. It would be nice to have that kind of metric, and maybe we could do that right now with like smartwatches and everything, to look for patterns of this, to really now start to figure out and pinpoint the stimulus that's evoking this. Yeah. We could get down to the nitty-gritty on this stuff, but yeah.
Oh no, I'm sorry. I see. I think you're very much onto something there. I really believe, and because I see things sort of through a behavioral lens, I think, in a sense, if you do not provide correction or sort of corrective feedback to a kid when they're in having these kind of persistent difficulties, I mean, it's hard for me to say that you're doing them any kind of a favor. You know, like, it's kind of like, oh, well, we didn't upset you. Well, I mean, name a person in life who doesn't get upset sometimes. You know, I don't know that anyone is really going to ever be exempt from that. And you don't want to be cruel, right? We know that. That's a kind of bottom line thing. But it's like, if we don't correct this, not only will it continue, but it may morph into some other things that are considerably worse for kids.